Hi there. Thank you so much for joining, everyone. Hope you enjoyed the music. My name is Gabrielle Nichols, and I'm with the Big Cities Health Coalition. And again, we're thrilled to have so many of you here with us today. If we could go to the next slide, please. So the Big Cities Health Coalition is a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health of the nearly 32 million people they serve. You can see our 30 cities that make up our members on this map on the slide. And again, thank you all for joining us today. We are so pleased to be able to have this important discussion and share this tool with you. So as everyone is already doing, which we appreciate, we'd love to get a sense of who's with us today. So please add your name, location, and organization in the chat, selecting panelists and attendees so everyone can see. So like I said, I'm Gabrielle Nichols with the Big Cities Health Coalition, and I'm joining today from Washington, D.C. So I'm so excited to see everyone from all over joining from all different health departments and organizations. We really appreciate all of you being here. We're actually going to close the chat after we're done with introductions, and then we'll open it again at the end. But the Q&A will still be open, so you can keep typing your questions in that Q&A box. And we'll monitor that and lift up questions too. So we'll answer, the speakers will answer. So thanks to everyone for sharing where you're from. If we could go to the next slide. So we're also live tweeting today, and we encourage you to use the hashtag health equity tool. And any tweets you post about the event today, you can see it on the screen there. And with that, I'm excited to turn to our content. As a very, very brief background, in March 2020, the Big Cities Health Coalition, we asked our members additional ways we could support their COVID response efforts. And almost across the board, everyone raised the issue that equity was vital to their efforts, as that's right when they were discovering large racial and ethnic disparities in cases of COVID. But there wasn't always a clear way to combine traditional equity tools with the traditional public health emergency response operations that were already in place. So we partnered with the wonderful team at Human Impact Partners to identify how we could help fill this gap. And this tool is that result. So we're really excited to dive into it today and share it with you all. So to do that, we're joined by three fabulous speakers who I'm going to quickly introduce, and then they can add additional details about what they do as they share more with us. Lili Farhang is the co-director of Human Impact Partners. For nearly 20 years, she has visioned, developed, and implemented policy and systems change to advance health equity in the government and nonprofit sectors. She works at both the New York City and San Francisco health departments, and she's feeling energized by people's willingness to talk about race, power, and the root drivers of health. Gretchen Musicant is the Minneapolis Health Commissioner, where she oversees the city's health department. For the past year, she has directed the city's response to COVID-19 as part of that role. She's a current member of the NACHO Board of Directors and an active member of the Big Cities Health Coalition. Heather Northover is the director of the Center of Health Equity, led by the Los Angeles County Department of Public Health. Prior to her current appointment, she served as the senior advisor to the chief deputy director, special assistant to the director, and in multiple capacities within the Division of HIV and STD programs. She is also a proud alum of the Health Equity Awakened Leadership Institute, sponsored by Human Impact Partners. Thank you, Lili, Gretchen, and Heather for being with us today and sharing. First, we're going to turn it over to Lili to kick us off. Thank you so much.
Yeah, thank you, Gabrielle. Thank you, Gretchen and Heather, for joining. Thanks to the 450 plus people who are giving us an hour of their time today. I know that past week was really kind of a lot for people to handle. I've been like obsessed with the news and kind of tracking what's going on with the mob riots last week in DC, and I really appreciate the chance to be in community with all of you in public health who are working so hard all over this country to kind of address so many of the issues that we're seeing in the COVID pandemic and that we are seeing needing to be addressed with the uprisings from this past summer. So thank you for carving out an hour and joining us. Anna, can I get the next slide? So what we're going to do for the next little stretch of time is I'll highlight the what the actual equity lens tool is. And then we're going to have two sort of quick presentations from Gretchen and Heather about ways that their health departments have been considering equity in COVID planning, response, decision making. And then we're going to do like a little bit of a dialogue around some of the questions in the tool and vaccination issues that obviously every health department in the country is dealing with right now. So with that, I'm just going to quickly kind of walk you through what's in the document that was released. So just a little bit first about us at Human Impact Partners. We're a national nonprofit. We're based in California. Our mission is really to transform the field of public health to center equity and to build collective power with social justice movements. We do that work through hands-on research and advocacy with social justice groups, through direct organizing and capacity building of the public health sector to advance equity. And this equity lens tool that we worked on with the Big Cities Health Coalition is an example of that sort of capacity building work that we're trying to do with the field of public health. Next slide, please. Just to situate this tool kind of in a broader range of things that Human Impact Partners does, we offer health and racial equity training and technical assistance to local and state health departments. We run leadership development programs for emerging leaders in governmental public health, such as the Health Equity Awaken Leadership Institute. We have the Power Building Partnerships for Health initiative, which brings together local health departments and grassroots community organizations. And then we develop resources and tools to help advance equity. For example, our Health Equity Guide and this Equity Lens tool. Next slide, please. So our goals with this project, Big Cities Health Coalition commissioned us to help create this tool for its 30 members to use in the context of COVID-related decision-making. We recognize, however, that the 2,800 plus health departments in this country could benefit from this tool beyond just the Big Cities Health Department members. And our goal with this project was really to provide a resource for health departments and their sister agencies to create greater momentum and to re-energize the practice of applying an equity lens in COVID decision-making. We know that health departments kind of across the board have made commitments to advance equity, but there's a way in which this pandemic and the fast-moving nature of decision-making has just meant that that commitment sometimes gets harder to implement and bring forward. And so our goal was to try to reignite and provide some hands-on tools for folks to be able to do that. The goal also is to help you all assess how decisions will be experienced by specific communities and to ensure that decisions work for the people who are most impacted, and to suggest an approach for engaging with and remaining accountable to communities who have historically been disenfranchised from decision making. And I'm just going to state the obvious because it needs to be said out loud, even though all of you know it really well, which is that we have to take these commitments really seriously because COVID disproportionately exposes, sickens, and kills Black, Brown, Indigenous, Asian American, Pacific Islander, immigrant, incarcerated, and lower income people at rates far higher than their white, non-immigrant, and higher income counterparts. And that we're all sort of experiencing the history of systemic racism in employment, housing, health, and social policy is really patterning the inequitable exposures and outcomes that are persisting through this COVID pandemic. And so making decisions based primarily on what's most expedient or workable is, as we all can agree, problematic because we don't want to be exacerbating existing inequities. And so we really offer this tool to health departments to, again, build some momentum around, re-energize this practice of more directly and routinely considering equity in decision making. And I want to acknowledge, it's not going to be a panacea to solve the persistent inequities in society. It's just one small, narrow approach to share decision making power in ways that can directly improve people's lives. Next slide, please. I'm not going to go into this in too much detail. We just want to say that there was a background of work that was done that we led to sort of create this tool that included interviews and landscape analyses. And I want to really highlight the work of the Government Alliance on Race and Equity, who has done a lot of work to popularize equity lens tools for government decision-making broadly. And what we really wanted to do was situate the kinds of questions that get asked in the GARE tools in a public health context, and to sort of create something that would be targeted for public health practitioners. Next slide, please. So based on all the input in the process, we went ahead and created this equity lens tool that we're excited to share with you today. Jamie's going to be dropping the links into the chat, so if folks haven't seen it, they can check it out. Next slide, please. So broadly, just to like provide a little bit of framework and definitions around what this tool is, equity lens tools generally are designed to integrate explicit consideration of equity, and most often racial equity, frankly, into decisions before they are made and implemented. And when I say decisions, I'm talking about policy, programs, plans, budgets, really like every decision you can imagine. And the goal of these tools is to systematically assess how different groups might be affected by a decision, identify adverse consequences, and adjust decisions or propose recommendations to address those impacts. And just to say, like, it's not, we know equity is not only an outcome, it's actually, at least from a public health perspective, we believe that equity is a process. And so community involvement in implementation of an equity lens tool application is a core component. It's actually not, in our opinion, it's not advancing equity if there is not a tangible community involvement component to the process. And you know, the idea of applying this kind of tool is not a radical proposition. Across the US and internationally, municipalities, elected bodies, administrative agencies, they're integrating this kind of thinking and these kinds of tools to examine how racial and other inequities might unintentionally result from their decisions. And they're adjusting those decisions to prevent impacts, negative impacts from happening. I think for those of you that are familiar with the practice of health impact assessment, we'll see a lot of commonality here. Next slide, please. So who is this document, this tool that we created for exactly? So what I want to say is that it can be used by anyone working in a health department's COVID planning, response, and recovery context, particularly for those folks that are leading or coordinating response and who wishes to ensure equity in a decision. But it's not only for those folks in a public health department's response, it's really for all those involved in COVID response. We just recognize that often those in the public health sector, because of a longstanding commitment to health equity, may be in a good position to sort of lead the effort to implement a tool like this. Bringing it sort of into larger emergency response or incident command decision-making structures can actually help hold your colleagues and other agencies more accountable. And so because we know that COVID has really kind of, every health department is in a different decision-making climate. Some are on their own, some are part of incident command, some are part of a coordinated emergency operations center. Like, it's really hard to recommend or assign a specific structure or responsibility for who should apply this tool. And from the interviews we did, we didn't hear consensus around that. And so regardless, so we're not actually recommending a particular structure. The thing that is the most important about using a tool like this is that it needs to be clear who the individual and team are that are designated to use a tool like this and to kind of be accountable to other stakeholders in using this kind of tool. And I think their role to the decision-making structure also needs to be really clearly articulated. And this will likely vary on a decision-by-decision basis. We cannot assume a constant approach to all decision-making when you're part of a political process, when you're part of a kind of an economic context. Like, we understand that the context for decision making is incredibly complicated, and so you have to be able to be nimble in how you use this. The most important thing is to have clarity around whose responsibility is it to use this thing, to use this tool, and what power do they have to influence the decision making process. Next slide, please. So we really heard from all the interviewees and reviewers of the tool. I mean, the list of places where they could apply this thing was absolutely endless, you know, to testing, to covering costs, to developing site-specific reopening plans, to requiring workplace and worker protections, particularly for low-wage and undocumented workers, for establishing policies and practices for folks that are incarcerated in jails, prisons, detention centers, for unhoused folks, for people in congregate care settings, for implementing policy decisions related to housing and economic security. I mean, it really is endless. And so we know that you're not going to be able to apply this kind of tool to every decision that you're faced with. And so there is a question around how to be strategic, like where would it add value? Where are you in a context where there's openness to your process? So I'm going to just now walk through a few aspects of the tool itself, and then I'm going to pass it along to Heather and Gretchen to kind of highlight what's going on at their agencies. Next slide, please. So one thing that's in the tool that I would encourage folks really to start with is to look at the process of what a good tool application looks like. Okay, so we actually don't want you to like just jump in and start answering the questions that are in the tool right away at all. That would not be the good first step. Actually, what we really want you to do is to be really clear about what your parameters are first. Who's leading the application? What role do they have to the decision-making context? What's the authority of the person who's running the application? Are they decider, or are they just giving input to the decider? How many resources, how much resources, what's your timeline? Like establishing parameters for the assessment, these things we're in fast-moving decision-making contexts, like being really clear about the parameters of this are going to help you be more successful in actually answering your questions and trying to get the information to the decision makers in a way that's useful. Once you establish those parameters, you can determine what your community involvement process is. If you're working on a decision that has to be made within 3 days, it's going to look really different than a decision where you have 3 months. So your community involvement process is really going to be based on your timeline, the nature of the decision, your political context. You need to do something with this respect in terms of involving community. And if you look at the appendices of the tool, you can see that we lay out different degrees of community involvement based on how much time you have and sort of the depth of involvement that you can muster. And just to say, like, we know that every department has some mechanism for involvement, right? People have their community health assessment processes, they have advisory committees and councils. So you have formal and informal relationships that you can draw on, you know, using your institutional capacity as you apply the tool. And then the next step, sort of before you conduct the assessment, is to develop a plan for that, for the assessment. What methods will you use? Who's going to be involved in answering questions? What's the feedback mechanism with communities that you're accountable to? Who are you going to communicate the findings to? And then once those steps have been once you've gone through those steps, you can actually go ahead and conduct the assessment. And I'll go over some of the questions in a minute, but you really should be planning to gather existing data and collect new data when necessary. That data might be empirical literature. It could be measures, quantitative measures that are available from existing surveys and data sets. It could be focus groups and community surveys. And what I want to be really clear is that community members are a source of trusted data, and talking to community members about their experience of the impacts is a key part of collecting data. It's not a separate thing, but actually that qualitative voice and story is equally as important as the quantitative measures you might gather. And just to say, it's not a linear process to do something like this. Often your steps will overlap and be circular, and the lack of data or conflicting data may make you need to go and get some other information or do additional community involvement to assess potential impacts. So this step 4 of conducting the assessment really is quite iterative. And then the last step in applying the tool is the communication step, where you need to kind of prepare your findings, and recommendations. You need to document kind of changes to any decision that you're proposing to make. You have to communicate those findings to the decision-making entity, and then really importantly, report back from an accountability perspective to community members what changes were made to the decision and where to go for more information. So there's a lot more in the tool around what each of these steps actually looks like. That was a super fast summary. Next slide, please. And this is just a brief, kind of short, small, brief, whatever the right word is, graphic that tells you the core questions that are being asked in the tool. So first, you really want to understand what's the decision being considered, who's the decision maker, who's doing the assessment. That's, the first sort of core questions. The second is what impacts will the decision have? How will it affect inequities? The third is how will you involve community members who are most affected in the assessment? And the last is making recommendations. These are kind of the core questions. And if you go to the next slide, please. I'm not going to go into these in detail. They're in the tool. There's a PDF version of the tool. There's actually a pocket guide version that you can download and type your answers into. So you're seeing screenshots of the PDF version, but if you want to just actually type into something, there's a Microsoft Word pocket guide where you can type your answers in yourself. And so each of those core questions gets elaborated into many more kind of detailed questions in the actual tool if you want to poke around in there. And before I wind down, next slide, please. I want to go back to something that I said really at the beginning, which is that using this kind of tool is not going to be a panacea to address all inequities associated with COVID. It's just one of many strategies needed to combat systemic racism and other forces driving inequities in COVID exposure and outcomes. And while applying a tool like this may bring you closer to a transparent discussion about trade-offs, we really can't be complacent about the wider political, social, and economic considerations that affect decision-making. I mean, we all know that there's other forces at play than the best public health evidence and guidance. We are living through that right now with the surge on top of a surge on top of a surge here in California that we're experiencing. And so zooming out and thinking about public policy advocacy related to healthcare access, Medicaid expansion, paid sick days, universal basic income, affordable housing, all of these issues create the conditions for health and equity much more widely. And so if those are in place, then it means our response to COVID and so many other chronic health conditions can actually be dealt with in a more fundamental way where we've changed the patterns of exposure that produce poor health and deep health inequities. So I want to just really highlight the importance of kind of engaging in wider public policy efforts to create the conditions that we need for health and equity. And then the other thing I want to note about why this isn't a panacea is that we know that uptake of a tool like this is influenced by who you're in the room with. Who you roll with is really going to influence your ability to take this and run with it. And in particular, the power and positional authority of others in decision-making contexts. We are not under any illusions that power is always at play in decision-making. And so thinking about sort of what is your own kind of organizing strategy to influence the people that you're working with so that they then understand how this equity tool can fit in is also a really important step in being successful in applying a framework like this. So some health departments might be at a beginner stage and need more training. Others may be committed to equity, but they need to influence their incident command and EOC structures. So in a space where a health department's voice is one among many, a tool like this really just is one narrow thing that will support more transformative change that's beyond this particular document. So the last thing I'll just highlight, last slide, please, are the appendices. You can check them out. They go into a lot of detail around community involvement, and I'm going to stop right there because I went way over time. And I'm going to ask, I'm sorry that I can't remember whether Gabby or Heather, whether Gretchen or Heather was going next. Heather, you want to jump in and just share for a few minutes about how your health department is kind of contending with tools like this?
Sure. So good morning, everyone. Again, Heather Northover, she, her, hers. Going to just talk a little bit about why I think this framework is so useful and give an example of sort of what has been going on in LA County, on where I think we could have applied this framework to really improve our response. So, it's just useful to just have a framework, right? I think Lili talked a little bit about this during her introduction, but, and you're all feeling this as well, we're all making a million decisions a day, very, very, very quickly, right? And what we know about thinking fast versus thinking slow, right, around sort of implicit biases, that our brains are more likely to activate our unconscious biases, and we're less likely to think critically and comprehensively when engaged in that system one thinking, right? And all of which are really important for making equitable and inclusive decisions. And quite frankly, when things hit the fan, right, I think equity is one of the last things that are on our mind, and then the last things that we're thinking about, because it's really just, particularly early on in the pandemic, it was just about survival, right? Putting together a structure and a response. And having a tool really allows us to routinize thinking about this type of thinking in all of our decision making, and helps us think through an equity lens in a systematic way from the beginning, with a template that really forces us to take a moment to slow down, to consider and assess, and assess quickly. In LA County, I would say we are extremely lucky to have leaders that have large expertise and experience in thinking about equity and using an equity lens. Dr. Barbara Ferrer and Dr. Muntu Davis have a lot of experience and a strong commitment to equity and orientation and frame toward equity and racial equity. But, I think standardizing sort of how we think through all these decisions across the department is useful, and having a toolkit that allows us to process and that's accessible to everyone is super helpful, and to have that baked into our ICS structure and our practice. It's important to have a quarterback. I definitely agree with that. Dr. Davis is serving as our health equity officer within our ICS structure. We have a small team that's really focused on equity, but it doesn't hurt to have a deeper bench, right? The one aspect that I think that it could have been really helpful is really thinking about sort of that step one, right? Establishing parameters for an assessment. We are so used to thinking about logistics and thinking about doing. I think a lot of us also think about community involvement, and that's becoming more and more a core aspect of our work, and something that's sort of automatic and a muscle that, we're continuing to exercise. I think it's that idea of really setting the stage that when we're moving quickly gets left behind, that really then has, unintended consequences later on in the future. Early on in the pandemic, probably late April, our department released a report called COVID-19, Racial, Ethnic, and Socioeconomic Data and Strategies Report. When you talk about not having the luxury of time, we were asked to do the report from our board of supervisors in 2 weeks, which is a crazy amount of time to pull that information together, do the analysis, and create strategies. I think if we had this toolkit, it would have allowed us an ability to push back a little bit on that timeline to the board, to provide us, with a framework so that we could sort of think through how can we do it in a really systematic, inclusive, and equitable way. Would have allowed us more opportunities to have much more robust community engagement. The strategies that we ended up putting in the report actually came from a lot of open letters, or letters that came from strong community advocates in our county. We actually pulled our strategies from their recommendations, where we didn't have a lot of buy-in and where we didn't have time to really go to our communities was around how we were reporting out the data. And once that report came out, we got a lot of pushback, particularly from our American Indian and Alaska Native communities, because the data really showed at that time that they weren't having an disproportionate impact, even though our gut sense, and probably if you take a look, obviously, at sort of historically, that definitely was the case. And we could have done a lot more massaging around how we framed that in the report. The other thing that I would say is that there have been a lot of, particularly around the data, a lot of advocates, particularly in our Asian American, Native Hawaiian, and Pacific Islander communities, that have talked about further disaggregation or more reporting on AA and HPI data, given sort of the disproportionate impact it's having, particularly on NHPI folks. And, you know, we could have done a better job early on being more clear about who the decision makers were and who the process owners were for a lot of the data collection, and how that impacted our dissemination of that data. And it was pretty further on in the process when we actually were able to sit down with our community advocates and we were sort of walk through what we as a department have control over, what we don't, and really carve out and talk about what their role could be in helping to activate an inside-outside strategy to really advocate externally on how we are collecting that data. It's really defined by, you know, the state, other players, and really driven by some of the antiquated data collection systems that we currently have. So I'll stop there. Lili, you're on mute.
Yeah, Gretchen, you're up.
Okay, thanks. I thought that's what you were saying. I'll say good afternoon, everyone, because I'm in a different part of the country. So Heather's got still good morning. I got good afternoon. So what I'm going to do with my time is just to walk you into maybe a little bit of why I think it's so important to formalize how we bring equity into responding, especially to emergencies. And so looking back a little over a year ago, December of 2019, we had a large fire in a hotel where there were many homeless people staying. And I realized during that response that we, as Heather said, I believe, we tend to get really busy doing right away in a crisis. And equity considerations, while they're on our mind, are really not as explicit as some of the other work we're doing. And so we created an intention to add a community engagement branch, if you will, to our incident command structure. So right at the beginning of a response, in addition to planning and operations and finance and logistics, we'd have community engagement so that we didn't allow ourselves to get too busy to explicitly think about those things. Now, if we'd had this tool, we would have used that tool in that branch. Virtually before we had even completed our hot wash on that fire, COVID hit. And so we had an opportunity to apply that thinking right away. Didn't have to commit it to long-term memory. And so we created a branch. We convened people from across the enterprise that were very connected to the community, the city enterprise. And then we also populated, or we created a shared power advisory committee of community members. We paid them for their time. We built also on some established community-based organizations that we had long-standing relationships with around emergency response. And so building on a thinking already about equity that was long-standing, but not as carefully organized and institutionalized. And so I think that's what we get with this tool. The Shared Power Advisory Committee met twice a week, once amongst themselves to kind of gather their thoughts, and then once to speak directly with myself as incident commander and our city council vice president. And so we had some of those good answers that we would have asked ourselves as part of the tool in place, but I think the tool would have helped us be even better. We have used that kind of community advisory group to influence our testing events, to help us have conversations with community leaders and members, to develop media messaging, to help in the distribution of protective equipment. And shortly or not shortly, but I guess COVID time has us so mixed up about what time is. But by the early summer, we had the very unfortunate murder of George Floyd and the community response that came after that. And this infrastructure that we had put in place was really helpful in responding to that. We were able to partner with the community around the notion of protecting people's health. This was potentially a super spreader event. We were able to distribute over 100,000 masks in just a long weekend. And we had tremendous uptake in use of masks. Community organizations were the distributors, and there was actually no additional spread of COVID that came out of that. And so I think that's a real demonstration of community engagement that can lead to increased health for our community. And so now we're leaning into planning and delivery of vaccination, and we'll talk about that as we have time for questions and answers. We're going to reactivate that Shared Power Advisory Committee. And we're really approaching this with the community as a shared learning. So not us as the experts telling community, but how are we learning together? And so as part of that, we're doing community surveys and dialogues and so on. So I guess in conclusion, I would say that the tool that we have before us is really helpful in reminding us that we have to think from the get-go about equity, and then we have to have structures in place, responsibility for responding to input, and plans for engaging community in the decisions that we're making. And I'm so glad that we have that tool. Thank you.
Thank you. So let's just spend like 3 minutes talking a little bit about vaccines and vaccination rollout and kind of how some of the questions that are in this tool could be useful kind of as you're managing decision making related to vaccines. And then Gabrielle, maybe they'll do this for a couple minutes each, and then if you want to do the Q&A, I'll go quiet. And so I just wonder, Gretchen, if you could identify like what's a decision that you're currently contending with related to vaccine distribution? Just like name one and how you could imagine using kind of the questions in this tool to improve your decision making related to vaccine rollout.
Well, one thing that's on my mind, has been on my mind for quite a while, is vaccine uptake. And so how can we work with people throughout our community to make sure that they feel comfortable and confident about a vaccine? And so we have worked with community asking that very question, and have developed a trauma statement actually that is available on our web. And I think someone can drop in a link to that. And that's a statement that we are using and reading at the beginning of any conversation we have with the community, because it became so clear that there are all kinds of issues that people bring to this present reality, and that we need to acknowledge those and in order to have real conversations with people.
That's great. Thank you. How about you, Heather?
So I think one thing that we're really contending with is prioritization of folks, which unfortunately we in this early part have less wiggle room than I think we will later in the phases, but really around distribution, right? LA County is huge. We have over 4,000 square miles and a social and political structure that's super complicated. We have 88 cities, of which we act as the public health department for 86. We have 2 other local health jurisdictions within LA County. We have a number of mayors and over 10 million residents. A third of our population are foreign born. We have 13 threshold languages. That is a small subset of 200 languages that are spoken in LA County. We have 47 law enforcement agencies, 26 fire agencies, 80 plus school districts. And so when you're thinking about how do you distribute it, period, and equitably, I think is really challenging, particularly with some of the different vaccines that require cold storage. And what we're finding is that capacity to do so is much less in areas that need and are highly impacted by COVID-19. I think where the tool would be helpful is, and continues to be helpful, is thinking about, as we bring people together, particularly around sort of, number 3 around engaging community partners, is really thinking back and presenting to them about what's the parameters of the decision making, what their role is going to be, and how there's going to be a feedback loop. Because I think when we all do community engagement and outreach, I think those are the things that get sort of left behind or not articulated well, because we're so much into thinking of like, we just need to gather the people together to get input and recommendations, which then later has consequences of people not feeling like their input and recommendations have been heard or actually implemented, which erodes trust and the willingness of people to come to the table, right, the next time around.
Thank you. Gabrielle, I'll pass it back to you to do the Q&A.
Good. We have a ton of questions. So thank you everyone for asking your questions and voting on everyone else's. So first, Gretchen, people have a lot of questions about your community advisory group board, shared power group. I forget the exact name. People want to know how the members were selected, how much you paid them, and just a lot more details. I think that people are really interested in that. So if you could talk a little bit more about that, I think that would be great.
Thank you so much. The name of the group was the Shared Power Advisory Committee, which I think is a really strange name now that I think about it, because you got shared power and you've got advisory all mixed together. But maybe that's an accurate assessment of where we are in our development. The stipend we gave to folks was a few $100s. And believe you me, that was really, really hard to get through city government to give a stipend. And as we reactivate the group to help us think about vaccine, we're actually using a nonprofit organization to make it easier to give a stipend. And there were certain expectations that came with the stipend. Interacting with at least a handful of other community members so that they weren't just speaking for themselves, disseminating information, helping to distribute personal protective equipment and that sort of thing. How we selected them was basically folks who were somewhat known to us, but we weren't selecting people who were like the heads of nonprofit organizations. It was more informal community leaders. And we also looked at the diversity within our diversity. And so we wanted to make sure that as many different categories of groups were represented, including the disability and elderly community, as well as cultural groups.
Great, thank you so much. So now a question for Lili. Could you talk a little bit about how this tool differs from other existing tools?
Yeah, I mean, I want to be really honest. Like, I actually don't believe so much that the questions that are embedded like way down in the tool are very different from questions that are asked in other tools. I think the thing that's probably a bit different is that we try really hard to delineate what the process for applying it could be in the context of many different stakeholders, many different players, different levels of power. And so kind of quick, like trying to walk through like, get clear on your parameters, get clear on what your community involvement strategy is, kind of get clear on where you're getting your information from, how you're reporting back. Like Human Impact Partners has a long history of doing health impact assessments. And I think what we've learned through the years is that the process of the assessment is like almost more important than the assessment itself, because if you're not set up to do it well, people kind of don't take it seriously. And if you're not transparent and clear about how you're connected to power and decision making, it's much harder to be effective with the results. And so I think we try to get in the weeds a little bit more about the process. We also try to offer, like in the appendices, examples of how you can match your community involvement and kind of impact analyses approaches based on the timeline and resources that you have. But I really want to acknowledge that, like, the core of the questions that are in the tool are common across a lot of the tools that others have created. And I much respect to Gare and Annie Casey Foundation, and like many organizations have put effort into doing impact analyses, including our own on the health impact analyses side. So a little bit of it is really about like giving it the imprimatur of a public health organization and like having it be framed in public health language and examples that we think might help its uptake in public health environments, which is where we're really focused.
Great, thanks so much, Lili. So we have a question about how to introduce the tool to leadership in a way that they can take it seriously with all of the barriers that we have addressed, the quick turnaround time, lack of time. So could you address this, Heather? I know you kind of said that you had a similar, have had time issues. So how do you think that you would go about introducing something to leadership for them to take it seriously?
And I think that's a really great question. One thought that I have is not sending it to them wholesale and just being like, hey, look at this toolkit, which I did in my organization. And actually they are using it to think through and plan sort of our work around the vaccine distribution. But it's really breaking that down. And when you're in spaces of conversations, just asking the questions that are in the toolkit, right? Like, you know, bringing some of the issues that the toolkit highlights to the fore and, you know, raising your hand and being like, have we thought about this? Like, what about this? And as you continue to do that further down the line, introduce it like, you know, all the questions that I've been asking or things that have been coming up, you know, it actually comes from this toolkit. Maybe this might be useful. And, you know, sometimes things don't get implemented well until after the fact. And so as we are going through this pandemic, you know, we want to use it in real time. And obviously everyone encourages you and us to use it in real time. However, it's something that can be introduced after the fact through a hot mop or whatever, and thinking about how to use it and embed it into structures and planning processes for the future, because in public health, there's no shortages of emergencies, right? Unfortunately.
Anything else to add, Gretchen, when thinking about introducing this to the leadership as leadership, but also understanding that you have to work with other partners who are different types of leaders?
Well, I really liked a couple of the ideas that Heather had, but I guess picking up on what Lili has said about the similarities in this tool to other tools, I think is helpful actually in promoting its use amongst leaders, because in our city, we're very familiar with the GARE process, and part of our expectations around bringing things to our city council are that we're going through some of these same types of questions. And so what this does is it allows us to take those expectations from one sphere of our work and bring it into another. So I think that's one additional idea, but I'm gonna take up that Heather idea of putting it into the hot wash for sure. Thank you so much.
So a couple of people are interested in what people learned using this tool for workplace protections. So if you could speak to this at all, Lili.
Yeah, I mean, I think, so one thing to say about all of these kinds of equity lens tools is that they are typically used when there is a decision on the table, right? So if you are in the stage of idea generation, and there's not actually something to contend with, then this might not be the right tool for you. And you might want to move towards like a health and all policies approach where you're thinking about how to kind of design the decision at the outset with equity considerations in mind. But these kinds of tools really work best when there is a concrete decision or proposal on the table and that you need to be kind of like quickly understanding how is it going to impact the communities that we care about. So on the work, the reason I say that is that on the workplace protection front, there are a lot of locales that are thinking about extending paid sick days protections for classes of workers. And this is sort of beyond what the Federal CARES Act did, or thinking about wage replacement, or like in California, the state government is considering going broader than kind of what is in the current federal bill that just got approved a couple weeks ago. And so the idea really is that once you have a proposal for $600, for example, in California on the table for workers, like as a wage replacement or as a income boost, that you kind of apply this and say, like, does this actually meet the needs of people that we're thinking of moving those funds to? And so in Wisconsin right now, like they are considering an expansion of paid leave policies where ideas that are in this tool basically infuse the analysis. And there's a report that recently came out in Wisconsin about what expanding paid sick days and paid leave would look like for workers in the state that are experiencing disproportionate hazards because of COVID. So I think like they're just coming out of the health impact assessment world, there are like many examples of applying tools like these to economic security and kind of workplace protection policies that people can look at.
Great, thank you so much.
I know the questions are coming fast and furious.
They are, and we really appreciate it that everyone is so engaged. And so, okay, so there's a really great question that kind of combines a couple other questions actually. So I'm gonna go with this one and see if everyone has something to say on it, and then I just lost it. No, okay. So achieving health equity requires collective and cross-sectional true collaborations. How do we get housing and probation and transportation and healthcare and employment, et cetera, effectively on board? A lot of times the community is clear and knows exactly what it needs. The difficulty is getting all of us on the other side to come together with community leadership. I would guess that all three of you might have some thoughts on this. So if you could each speak to this a little bit, because I know it is different in different areas, but there's definitely that challenge across the board.
I have a thought. So we have a couple structures of meetings now that we never had because of COVID. We meet regularly across the city enterprise. I really liked Heather's idea of just using the questions, not saying, here's a tool, let's all go through it, but raising those questions at those meetings across jurisdictions. So as our economic development folks and our public works folks are sitting on the call talking about responding to COVID and other associated crises that we are going through as a city, how can those questions be part of my contribution to that dialogue? So I think that's a great way without making people learn one more thing, but to actually just use it as a guide to what we say in meetings.
I would just agree with Gretchen on that. We have a large community work group that's dedicated to our vaccine response and 3 subcommittees that's really focused on equity, communications, and operations that all include community co-chairs. And so, you know, there are opportunities to introduce a tool to the community co-chairs to ensure that there's another advocate and voice at the table that are thinking through and asking these questions from the toolkit. I think, you know, when we are in emergency mode, we have a ton of folks from different sectors that are coming to the table, that are forced to the table or want to be at the table, and creating a pattern of asking these questions then sort of like embeds it into their psyche and the way in which they're thinking, in the same way that it does, you know, obviously for us as we think about the toolkit and have more practice in using it and applying it in our jurisdiction.
I'll just add one thought, I think, Gabrielle, before we wind down, if that's okay, which is that, so this is like where, so Human Impact Partners, we do lots of trainings for health departments, and this is where we really encourage health departments to be thinking about their, what we call their outside strategy, right? So you're showing, like, health departments are showing up into meeting spaces with departments of probation and transportation and different policing agencies. And I think we all agree that public health is probably like a weaker institutional agency compared to some of these other agencies that receive far more resources. You know, public health has been disinvested in for the past 10 to 15 years, whereas those other agencies have experienced like increases in their budgets and staffing. And so one of the things that I would really be thinking about is like, how is a public health department working with community partners to actually have them put pressure on those agencies to engage in discussions about equity, right? So I don't think it should fall solely on the public health agency to be, yes, we need a pattern of asking the questions. Yes, we need it top of mind and shouldn't be derelict in naming injustice and equity and all of that. At the same time, we know that like power moves people. And so if community organizations and partners on the outside can sort of get activated to apply pressure to those other departments, I think that helps create a justification for you to sort of keep pushing. So this like balance between inside, outside, or internal, external pressure is, I think, an important frame to keep in mind. Like, it's not, that's what we were saying, like the tool isn't a panacea. You need multiple strategies to really be thinking about how to make using a tool like this effective in your environment.
On that note, we are just about out of time. So I want to thank Lili, Gretchen, and Heather for joining us today and for all of your critical work over the years advancing health equity and racial equity in public health. So we actually reopened the chat, and we welcome you to leave any parting words or thoughts for our speakers before we sign off. I also want to thank our team behind the scenes who made this all possible. Anna Tellas, Jamie Sarfa from HIP, and Max Mays from BCHC, and our captioner, Chris. And thank you all so much for taking the time to join us. I'm just incredibly inspired that there were over 500 of you who chose to spend an hour of your Monday with us.